So Professor Lang has been a good friend for many years, and he has been speaking about William Osler. So this is my talk about William Osler, but also the development of non-invasive medicine. Confucius says this, and I have found also that it has been pleasant for many years to come and learn. And you have been very welcoming to friends from distant quarters, so thank you. When I came to Chongqing in the early days, I saw this picture of William Osler with his quote, and in the new Haifu building there is the quote, but Zubia, you need to have the picture as well. We have another quote from him which says, diseases which harm require treatments which harm less, and also we also know, as Professor Lang said, primum non nocere, first do no harm, which is the importance of us with medicine. William Osler had many quotes. I have written a little book which includes some of his quotes, which we are hoping that one day will be translated into Chinese with Professor Lang. But this is one of the things that he says, that the philosophies of one age have become the absurdities of the next, and the foolishness of yesterday has become the wisdom of tomorrow. And one of the great rulers of China in 2,000 years ago said that a talent for following the ways of yesterday is not sufficient to improve the world of today. And we know, those of us who work with Haifu, how differently the world has changed over the last 20 or 30 years. One of our Chief of General Staff in the UK in 1910, over 100 years ago, thought that the aeroplane was a useless and expensive fad. So some of the great teachers of yesterday are not always correct, and he, as we know, was proven very wrong. Well, we have had the privilege of working for many years with Haifu, and we had this little building at the back of our hospital on the top left for many years, and now the building at the bottom, unfortunately it looks as if this building is all our Haifu unit. It is not. It is our radiology and cancer center, but we have our machine, the JC200, in there. So as I have already said, I spent many years doing major open surgery. This top left one, it shows a kidney cancer which has gone up the major vein to the heart. And we were doing big open surgery with the cardiac surgeons to remove the kidney and to remove the heart. And as I said, my colleagues have done laparoscopic surgery and robotic surgery. I have missed those two. I have just gone from open surgery to Haifu, the non-invasive surgery. And most of you know that the idea of Haifu started in the 1940s in America with the Fry brothers. And we all know that ultrasound mainly produces the image, but of course if you put the power up, you produce heat. And if you put it up 10,000 times, as we know, you can kill cells. And this, again, many of you will have seen this and know that this is the demonstration of Haifu ablating a liver cancer. And this, again, is Just shows how that works. So we treated the first patient on the Chongqing machine in 2002 with our team, and my colleague James Kennedy did his PhD with me and Professor Gail Tahar, who is unable to be here tonight. Some of you may remember James. I was speaking with him yesterday and he sends his regards. But he trained in Cambridge and then came to Oxford to do his PhD. He wrote up this paper in Nature Reviews in Cancer, looking at the focused ultrasound in the treatment of tumours in 2005. And he trained in Cambridge. He did his PhD in Oxford. He has now changed direction. He is now a priest in Oxford, but he remembers with great fondness his trips to Chongqing and his friends here. So clinical trials in surgery are not easy, but they are very important to get the procedures accepted in the world. Sometimes the technology is difficult because some people say, oh, if a trial maybe takes 5 or 10 years to do, maybe 5 years to do, and you do it on a machine, and then 5 years later people say, oh, but you have shown it on this machine, now we have a new machine and we cannot necessarily understand or believe what you say, or maybe it's different, maybe it's better. We have to get the agreement of the patients, and there is a lot of what we call vested interest by some of the clinicians. So sometimes they make more money doing surgical procedures than HIFU. Sometimes they are reluctant to look at new technology. So there are problems with trials, as we have found in Oxford, and I'm sure anybody who does trials knows that. But we have managed to do quite a few things in Oxford, looking at different areas. We started off with liver and kidney, and we have treated various other things. And I will show you a few of these. Occasionally we have blisters on the skin. Once we had a big skin burn, but that was in a person who was very large, where we did not have proper coupling to the patient. One of our first papers was in 2005, when we looked at the results of our treatment with liver and kidney tumours. And we managed, with James's hard work, to get the approval of the European Community in June 2005 for the Chongqing machine. We still have the only one in the UK, but now I'm delighted that there are many around Europe. And this is one, we did several kidney trials looking at the JC extracorporeal. We did a short study looking at laparoscopic HIFU, and we have looked at other things which I will talk about in a minute. So here is one. I'm not sure how well this shows up at a distance, but this was a kidney tumour which we successfully ablated, showing the lack of uptake 12 days after, and indeed even up to 5 years later there was very good, there was no recurrence of that tumour. And we have been looking a little bit too at the immune response, which we are looking at in more detail now, and looking at anti-tumour immune response through decreasing the T-cell suppressors. And the interest is whether or not you can reduce the incidence of metastatic disease with HIFU. And if that is shown to be possible, then one of the things that maybe you could do, for example, kidney is difficult to treat, but if you had secondaries from a kidney, maybe you could treat a secondary if it was more easily accessible, and that may have an effect on the primary tumour. We did a short thing looking at laparoscopic HIFU, and it works, but of course it is not, it is still invasive. But we did treat this tumour laparoscopically and show that there was a good ablation. But we have stopped doing that because that is not, it is not non-invasive, but we showed that it could work. The problem with kidneys, we found two things. One is the ribs sometimes make it difficult, and the perinephric fat makes it difficult. So we took the fat when I was taking some of the kidneys out for surgery. We took some of the fat and we looked at that with HIFU, and this is what we found, that depending on the thickness of the fat, the thicker it was, the more it absorbed the HIFU beams, and you got decreased percentage of output as the fat increased. So with the kidneys, sometimes we had ablation, sometimes not. With a kidney transplant, as you probably know, if you do a kidney transplant, you do not put it under the ribs, you put it in the groin. And also, if you're doing a kidney transplant, you take all the fat off the kidney. So in the groin, we had two patients who had tumours in a transplant kidney who we treated with HIFU. And there we had extremely good results. I did then go in afterwards and take the tumour out, but when we looked at it under the laboratory, we had 90% ablation. It was just the rim of the tumour that was not ablated. Prostate cancer, we have been using different machines, transrectal machines in Sonoblate and Ablatherm. Prostate cancer is a problem because survival for prostate cancer is not a good outcome, because many people, if you are 70 years old, there is a 70% chance that you have prostate cancer. Most prostate cancers do not kill you. It is only a few prostate cancers that kill you. And if you look at this green area, these are men diagnosed on the basis of a prostatic specific antigen. But the blue area is the people who die of prostate cancer. So survival, most people will survive with prostate cancer. And the problem with prostate cancer is knowing how to treat. This is a busy slide which shows that there are different machines for treating prostate cancer, but there are increasing studies showing that the effects for treating prostate cancer is good, and the side effects may be less than many other studies such as radiotherapy or surgery. This is another one that we've been looking at, sacral chordomas, and again you may be able to see these sacral chordomas, big locally invasive tumours, and after treatment you get lack of uptake. This was a lady who had trouble sitting down, but after treatment she was able to sit down. So we had good effects with sacral chordomas. We wrote this up in a neurosurgical journal. And pancreatic cancer we have been doing a little bit of work on as well. My colleague Paul Lyon and Professor Feng Wu have been looking at that, and we have been treating some patients with prostate cancer. And for pancreatic cancer, pancreatic cancer does not have a good survival rate. And the other thing is that the pain sometimes is difficult to control with opioids, but with HIFU it often does help the pain, as Professor Feng Wu has shown before. And there is a lot more work. Other people are doing perhaps more than we are on pancreatic cancer. We may hear some of that later on. But it is still possible to treat this, and this was one of the patients that we treated with for palliative response. And Professor Gail Tahar, again familiar to many of us, who was very sorry she was unable to come to Chongqing. She has looked at the reviews of over 3,500 patients over the last 20 years and finds that it does produce effective pain relief and sometimes control of growth with improved survival rates. And we have been looking at two studies, one just ablation of pancreas and one targeted drug delivery. Unfortunately, as we have all found during COVID, many of the trials had to stop and the targeted drug delivery has not been going so well. Fibroids, I will not spend long about fibroids. I think we all will hear a lot more about fibroids, so I will pass over fibroids, apart from saying that this was written up, 20-center Chinese study was written up in 2017. And as a result of much of the work, we had that NICE approved, and we're just going through a revalidation process with NICE at the moment. And Paul Lyon and Konstantin Kusios in biomedical engineering have also done this targeted drug delivery for liver cancer using the focused ultrasound hypothermia to release doxorubicin from thermosensitive liposomes. And they are stable at 37 degrees centigrade, break open at 42 degrees centigrade. So basically, taking a biopsy of the tumour, injecting the thermodox, and then heating up the tumour, and then treating it, and one finds that there is between 2 and 8 or 9 degrees increased in the drug uptake in those tumours. So that was my colleague Paul Lyon did this work for his PhD, and it was written up in the Lancet Oncology. This is interesting. Recently in the, from Washington State University, published in May this year, the idea of a low-intensity ultrasound for inducing torpor in rats, which means, the question is, can you induce that in humans? May that be useful in the future for international space flights to different planets. Very interesting possibility. So anyway, both William Osler and Mincikus are great humanitarians. Compassion for fellow humans is a matter of the heart, righteousness of the path. And Osler's philosophy, just as Professor Lang was saying, talks about compassion and care and science with humility, with no arrogance, thinking about the whole patient, physical, emotion and spiritual as well. And this was the Osler's Chinese edition of the Principles and Practice of Medicine, which we have a copy in Oxford. I've never seen another copy. If anybody sees a copy in China, I'd be very interested. But this was translated into Chinese in Shanghai in 1910. So here we are with the inauguration of the Chinese Osler Society in the Cotswolds in England in 2017. You may see Professor Zhang here, and Professor Lang and other people. So, and here we are in Osler's house in Oxford in 2017, and Professor Zhang sitting in Osler's study in Oxford. And this is what Professor Lang has sent to me, which we have hanging up in Oxford. Practicing medicine is an art based on science. I do not have time to read it. But the traits of a true commander are courage, wisdom, humanity, and integrity. Here is the pavilion in China, and this is Osler saying soap and water and common sense are the best disinfectants. So, thank you very much indeed. It's been a great pleasure to be president and to deliver this lecture.